all of us agree that it's different just to have the law. We have a very good Mental Health Care Act 2017, and as well others by the Constitution definitely is warranted to have a dignified life. But and as well, we need there are other acts as well that you mentioned to assure confidentiality or access to services. Um, what is lacking to make sure that those are applied? That citizens, it doesn't matter whether they are in below poverty or they are middle class or whatever, has access to care. It is warranted that there is quality care and confidentiality is maintained. What can be done in the legal perspective to assure that those are respected and adhered?
Right. So I think, look, from a overall civil society perspective, many things can be done. I know many things are being done, but I think on the legal side, I think it's very important to look at the enforcement of these rights, and we have seen cases of, you know, under even the Mental Health Care Act or other cases of individuals who are, obviously because of mental illnesses, etc., who have come before courts. Unfortunately, I think the issue has always been that courts have never not taken a very uniform approach.
Mm-hmm.
It really sometimes comes down to the judge himself or herself and how compassionate or and sometimes even compassion can result in the judge sort of taking a approach which is more protectionist rather than allowing the
Mm-hmm.
individual to do something. A lot of cases typically come in, of course, around treatment, but there are a lot of cases which come around property, right? Because
Mm-hmm.
obviously, individuals who are sort of going through, some type of mental illness or who are compromised in that manner, uh, do tend to see, you know, do tend to get into situations where they're not able to access funds, access property, etc. So I think one from a legal and from a law enforcement perspective, one thing which can be done definitely is creating more awareness about it, and of course,
Mm-hmm.
this should mean training our judges from
Mm-hmm.
even the lower and lowest level to deal with these kind of cases much more in a system and in a more uniform fashion. Two is, of course, I think the police, because typically a lot
Mm-hmm.
of these cases, whenever these issues come up, the police typically do come onto the scene. Many times, again, they also suffer from. I know in many states, I think earlier Dr. Lakshmi had brought up that there are trainings being done. I think,
Mm-hmm.
and in fact, on the obverse, the police and many of the frontline sort of workers, if you may call it, are also
Mm-hmm.
actually under risk of mental illnesses,
Mental.
etc. While they are being trained to deal with their own sort of issues, challenges, I
Mm-hmm.
think they need to be more compassionate and humane when they're dealing with these kind of situations. And I think overall, I feel that if we are able to address these two links, Arinda, I think this will be extremely helpful because these are typically in a day-to-day situation on the legal side. The police and the courts are extremely critical, and lots of a lot of the cases where I see people struggling to enforce their rights and to get a get a balance in terms of what they and of course enforce these many rights that are there on our law books.
Mm-hmm.
Our struggle is mostly because they're either not able to get a favorable decision in the courts, or of course they have to wait for many years. So I think there are also systemic issues as well. We have
Okay.
we have very slow judicial process. We have an extremely I would say difficult situation with the police. There are very few policemen. They have to deal with a lot of people. So sometimes, yes, it is also capacity issue, etc. But
Mm-hmm.
training and sensitization, I feel,
It's
would make.
important. Okay. Yeah, thank you so much. The last thing that I wanted to mention here is we have the act that protects people with disability, so people who are diagnosed with mental illness. But I'm aware, but from your perspective, is there something that protects people who don't necessarily are diagnosed with a mental illness, but they struggle with their own day to day. The idea is that how do we have some acts or laws or so, what do we have there to prevent, to promote well-being, to encourage prevention, to encourage self-care. For example, you may not be able to do this to enforce some as to an individual, but definitely you can do something with colleges and universities to have some minimum services and standard with corporates who have a big say in how they deal with their team in setting a minimum standard of this must be there, not only to assure that we take care of people who are diagnosed with mental illness, but to assure the rights of people who need to preserve and need to enhance their mental well-being.
Right. So, are you able to hear me?
Yes.
Yeah. So sorry. So I think absolutely. So I think uh, it may not be legal point, but definitely you're right. This is something which, and I think there has been obviously much movement on the space, right? Obviously, with some recent, unfortunate situations a few years, maybe now a year back, was the
Yeah.
EY trainee case where she, obviously there was a definite uh, sort of may not be a finding of court, but definitely there was a clear understanding that there was some issue with the work pressure. So I think, no, absolutely. So I think there is a need to do much more. We have obviously currently there is a process and way to standardize and make uniform our labor laws. As you may have heard, of course, we have four labor codes which have been waiting to get implemented.
Mm-hmm.
But and of course, those deal with things like occupational safety. Those deal with things like your social security, etc. But I think I think one important factor that probably they miss is just this entire thing of providing balanced work-life,
Mm-hmm.
situation. So I think while of course there are regulations that say what is the number of hours which people can work,
Yeah. Mm-hmm.
but as most of those laws are sort of difficult to implement, etc. For anyone who's not in a factory type situation where they're clocking in and clocking out. But definitely, I think much more from a legislative side could be done. I know that there was a few years back there was a right to disconnect bill which had been brought in and various other steps taken. But definitely, I think um, a legal intervention would be great because like you said, and I think the conversation which was going on a while back was, of course, large companies like I think some examples were given could definitely drive a change. Uh, and until laws come in, I think that's probably the only hope we have that large
Mm-hmm.
companies, whether they're multinationals or even Indian companies like the Tatas, etc. If they drive this change, this will help.
Mm-hmm.
Um, some recent corporate sort of quotes, I don't know, corporate leader quotes saying that you must work 90 hours a week, etc. don't really help. I
Yeah.
think somewhere people need to just take a view that, hey, I mean, I think everything that or many of the things which some of these people say is taken on, and there's obviously uh, leads to a big debate. But I think there's obviously much more that can be done.
Yeah.
I mean, you brought up
Thank you.
some
Yeah.
good
Yeah.
points.